Today we will understand Downer cow syndrome, also called bovine secondary recumbency. First, a primary problem causes the cow to become recumbent. If this problem is not treated, the cow remains down for a long time. This prolonged recumbency then causes secondary damage to muscles and nerves, and because of this damage, the cow cannot stand even if the original problem has been corrected. Downer cow syndrome. Cows are of two types, alert and non-alert. Alert cows are bright, can eat and drink, and stay sitting in sternal recumbency. Non-alert cows are dull and depressed, or have abnormal behavior, which usually means a serious body illness or nervous system problem. This condition is most common in dairy cows, especially around calving time and early lactation. The main primary causes include hypocalcemia, dystocia, and injuries from slipping or falling. In some alert cows, hypokalemia and hypophosphatemia may be involved. In non-alert cows, causes include toxic mastitis, metritis, digestive problems, severe ketosis, and liver failure. The main issue starts when the cow remains recumbent for a long time. The body weight presses on the muscles and nerves, especially in the hind limbs. Blood flow is disturbed, and as a result, muscles develop ischemia and necrosis, and nerves like the sciatic nerve get damaged. Muscle breakdown may release myoglobin, which can damage the kidneys. Clinically, these cows are often seen after calving. Some cows look dull and weak, showing signs of metabolic disease. Others may look normal and alert but still cannot stand. The position of the limbs can help in diagnosis. For example, if a cow's back legs are stretched straight behind, it may mean nerve injury or a broken bone. Slippery floors increase the risk of injury. Diagnosis mainly depends on physical examination. First, take a proper history, including how long the cow has been recumbent, details of calving, and previous treatment. Then observe the cow's posture, awareness, breathing, and signs of struggling. After that, check hydration, temperature, heart rate, and digestive activity. Special examinations include checking the udder for mastitis, vaginal examination for injuries or metritis, and rectal examination for pelvic fractures, dislocations, or digestive problems. Tail tone and anal reflex help check nerve function. If the tail is weak or the anus does not contract when touched, it may indicate nerve damage. Try to make the cow stand and watch how it puts weight on each leg and how well it balances and moves. Supporting tests include blood tests for calcium, phosphorus, and potassium. Increased creatine kinase shows muscle damage, and high aspartate transferase indicates a poor prognosis. Urine may appear dark due to myoglobin. Ultrasound can help detect fractures or soft tissue problems. Treatment starts with correcting the primary cause. Supportive care is very important. This includes pain control, proper hydration, and nutrition. Oral supplementation of calcium, phosphorus, potassium, and energy sources like propylene glycol may be given. Good nursing care is very important for recovery. The cow should be kept in sternal recumbency and turned every 6 to 8 hours to reduce pressure damage. Provide soft bedding like sand or straw and protect the cow from extreme weather. Try to help the cow stand daily. Use lifting devices properly to avoid more injury. Flotation therapy can also be used, where the cow is placed in lukewarm water to support its body and help it stand. If the cow can stand or walk early, the chances of recovery are better. Moving a recumbent cow should be done carefully using proper support. Avoid dragging or improper lifting. The prognosis depends on early treatment and good care. If there is no improvement within about 7 days, the outcome is usually poor. Animal welfare is very important. If the cow stops eating, becomes weak, develops severe wounds, or shows no improvement, slaughtering should be considered. Transporting recumbent cows without proper care is not allowed in many places. Prevention includes controlling primary causes like preventing milk fever, close monitoring around calving, providing good flooring with proper grip, and avoiding overcrowding. Thank you for watching VetCare. If you found this video helpful, like, share, and subscribe for more simple and practical veterinary learning.